8 popular drugs that cause kidney damage. Did you know that any medication you take passes through your kidneys, and that 1 in every 5 cases of acute kidney failure is due to medications? This is because one of the main functions of the kidneys is to eliminate toxins, waste, and harmful substances circulating in your blood. The kidneys also remove excess fluid by filtering the blood to produce urine. In addition, they maintain balanced levels of electrolytes, the body's salts, and produce hormones. These hormones influence your blood pressure, your bones, and your blood. If any toxin damages the kidneys, they may fail to perform their job. Therefore, understanding whether the medication you are taking could harm your kidneys is crucial. Today, we'll explore the 8 types of common or daily use medications stored in your cabinet that may be harming your kidneys, and you'll learn what to do to prevent kidney damage. But first, if you find this video helpful, please consider giving it a thumbs up and subscribing to our channel. Hit the notification bell to stay updated with our future videos. Also, consider sharing this vital knowledge with your friends and family. Approximately 37 million Americans suffer from kidney disease, and many are unaware of their condition. By sharing, you contribute to spreading awareness and potentially helping others. Some medications can damage your kidneys even if your creatinine levels are normal, your urination is regular, and you currently have no kidney problems. Importantly, if your kidneys are already compromised, these medications can exacerbate their condition, potentially leading to chronic kidney failure. In such cases, treatments like hemodialysis or a kidney transplant might become necessary. If you fall into any of the following risk categories, you may have a higher chance of suffering kidney injury due to medications. Existing kidney failure. Age over 60. If you have diabetes, high blood pressure, heart failure, including conditions of a weak or enlarged heart, inadequate fluid intake, or conditions like diarrhea or use of diuretics. Suffering from an infection, obesity, have high cholesterol. Excessive alcohol consumption, which can damage not only the liver but also the kidneys. Alcoholics are at a high risk of developing both liver and kidney failure. However, it's crucial to understand that certain medications can harm the kidneys even in individuals without these risk factors or existing kidney problems. Discover now the 8 popular medications that are most harmful to the kidneys. Pay special attention to the last one on the list. It's the most common cause of medication-induced kidney problems in practice. So it's very important that you watch until the end to get all the vital information. Number 1. Antibiotics. Antibiotics are among the medications that most harm the kidneys, and they can cause damage in various ways. Aminoglycosides. This group includes the most toxic neomycin, followed by gentamicin and amikacin. Sulfonamides. Commonly found in medications like Bactrim, they can produce crystals that block urine flow. Vancomycin. Known to cause swelling and inflammation in the kidneys, potentially leading to renal failure. Quinolones, for example, ciprofloxacin. These can lead to interstitial nephritis. It's important to remember that if you have kidney problems, the dosages of some antibiotics need to be adjusted. Reducing the doses is crucial to avoid further damaging the kidneys. 2. Laxatives. While laxatives are generally safe for most people, there are certain situations where they can pose a risk to kidney health. One of the key concerns is dehydration. If laxatives lead to significant dehydration, this can potentially damage your kidneys. However, a specific risk comes with some types of laxatives used for bowel cleansing before procedures like a colonoscopy. Laxatives containing sodium phosphate in particular can be harmful to your kidneys. Therefore, it's important to use these products under medical supervision and ensure adequate hydration. 3. Antivirals. If you've been treated for herpes simplex or herpes zoster, your doctor may have prescribed antivirals like acyclovir or valacyclovir. It's important to be aware that these medications can cause swelling and inflammation in the kidneys. They can also produce crystals that do not dissolve, potentially leading to kidney issues. This category also includes antiretrovirals used for treating HIV, such as tenofovir and indinavir. These medications can cause toxicity in the renal tubular cells. Given these risks, it's crucial to stay well hydrated when taking these antivirals to help minimize potential kidney damage. 4. Blood pressure medications. Angiotensin-converting enzyme inhibitors and angiotensin receptor blockers are commonly used to control blood pressure, thereby reducing the risk of stroke and other cardiovascular diseases. Examples of ACIs include benazepril, Lotensin, enalapril, Vasotec, and lisinopril, Prinavil, Zestril. Interestingly, these two classes of medications have a dual effect on the kidneys. They act on the efferent artery of the kidney by causing vasodilation. This action is beneficial in conditions like heart failure, hypertension, or diabetes, as it tends to preserve kidney function and slow the progression of kidney damage. However, patients with certain kidney conditions may need careful monitoring and dosage adjustments when using these medications. In situations where a person is severely dehydrated or has end-stage renal disease, these medications, which are normally protective of the kidneys, can become a risk. In such cases, they may lead to the need for hemodialysis and can also potentially increase potassium levels in the blood. Therefore, when the kidneys are significantly impaired, it is often advisable for the doctor to discontinue these medications. This decision is made to prevent further kidney damage and manage the risks associated with advanced kidney disease. 5. Medications for gastritis and heartburn. Proton pump inhibitors, which are commonly prescribed for conditions like heartburn, acid reflux, and gastric ulcers, have been associated with certain risks concerning kidney health. According to a recent study published in the Journal of the American Medical Association, prolonged use of PPIs is linked to an increased risk of developing chronic kidney disease. Additionally, these medications can contribute to the progression of existing chronic kidney disease and even lead to end-stage renal disease. Some PPIs that may be linked to kidney damage, especially with long-term use, include omeprazole, lansoprazole, and esomeprazole. Research indicates that individuals who use these medications chronically face a 20% to 50% higher risk of developing chronic kidney disease compared to non-users. While the study does not establish a direct cause and effect relationship, it was noted that the risk of kidney problems increases with higher doses of these medications. 6. Psychiatric medications. Prescribed medications used to treat mental health conditions can pose risks to kidney health. For example, Prozac, fluoxetine, a commonly prescribed antidepressant, has been associated with kidney problems. High levels of lithium in the blood can also lead to kidney issues. Additionally, in elderly patients, certain atypical antipsychotic medications like quetiapine, olanzapine, and risperidone have been linked to an increased risk of hospitalization due to acute injury. If you are taking any of these medications, the best course of action is to have a conversation with your doctor. They prescribed these medications after considering the potential risks and benefits and determined that they are the most suitable treatment for you. 7. Diuretics. Have you ever visited a cardiologist who prescribed you a diuretic for hypertension or heart failure? It's a common prescription because diuretics are beneficial for both conditions, helping the body eliminate excess fluid. However, it's important to be aware that in some cases, diuretics can lead to dehydration, which may not be favorable for your kidneys. Examples of diuretics include furosemide, Lasix, hydrochlorothiazide, indapamide, and chlorthalidone. Dehydration can potentially affect kidney function, so it's essential to use diuretics as prescribed and stay adequately hydrated while taking them. 8. Anti-inflammatories. When it comes to medications that can potentially harm the kidneys, anti-inflammatories are at the forefront. Common household anti-inflammatory medications like ibuprofen, naproxen, diclofenac, and aspirin are widely used, but can pose risks to kidney health due to their frequent use. Prolonged and frequent use of these medications can contribute to the development of chronic kidney disease, CKD. Everyone has experienced joint pain, menstrual pain, or muscle pain and turned to anti-inflammatories for relief, but they can reduce blood flow to the kidneys, potentially leading to renal failure and interstitial nephritis. The most significant risk arises if you already have an existing kidney problem and decide to take an anti-inflammatory. In such cases, it can trigger acute renal failure, often requiring emergency hemodialysis. The risk increases, especially after the third day of use or with long-term use at higher doses. The good news is that kidney disease related to anti-inflammatories is preventable with caution and awareness. Many people wonder if aspirin can cause kidney problems, and the answer depends on how it's used. When taken as directed and within recommended doses, regular use of aspirin does not appear to increase the risk of kidney disease in individuals with normal kidney function. However, it's essential to be cautious about excessive doses, typically exceeding 6 or 8 tablets a day. Taking excessively high doses can lead to a temporary and possibly permanent reduction in kidney function. Additionally, it's important to be aware that certain medical exams, known as imaging tests, may involve the use of a type of dye called contrast dye. Examples of imaging tests that may use contrast dye include magnetic resonance imaging, MRI, and computed tomography, CT, scans. Contrast dyes can be harmful to people with kidney diseases. However, not all imaging tests require the use of contrast dyes. Which painkillers are safe for people with kidney disease? Paracetamol and dipyrone are generally considered safe options for individuals with kidney disease. If you require an anti-inflammatory medication, the ideal choice would be a corticosteroid. However, it's crucial to be aware that corticosteroids come with their own set of risks, including conditions like osteoporosis, increased glucose levels, and cataracts. It's important to emphasize that the absence of a medication from this list does not guarantee it won't harm your kidneys. Medications used for osteoporosis, chemotherapy, anti-rejection drugs for transplants, and even certain supplements can pose risks to kidney health. How to avoid kidney injury? Do not take any medication without it being prescribed by your doctor. Not even supplements. Some supplements like chromium, yohimbine, creatine can harm a kidney that is already in trouble, so be extra careful. Additionally, it's crucial to prioritize hydration. Adequate fluid intake ensures that your kidneys can effectively eliminate toxins from your body. Dehydration is a known risk factor for kidney failure, as it can lead to the concentration of medication in your system, potentially causing harm. Stay well hydrated to safeguard your kidney health. Avoid drinking alcohol while taking medications, as alcohol can lead to dehydration, increase blood pressure, and elevate the risk of kidney problems. If you have high blood pressure, ensure it is consistently under control. Both high and very low blood pressure can potentially harm the kidneys. In the case of diabetes, it's essential to maintain well-controlled blood sugar levels to minimize the risk of kidney issues. And if you already have kidney issues, consult your nephrologist regularly. It's important to note that individuals with kidney problems should avoid consuming starfruit in any form, whether it's the juice or the fruit itself. According to studies, starfruit contains a substance known as caramboxin, which can be neurotoxic if it cannot be excreted through the kidneys. In such cases, it can lead to intoxication, resulting in symptoms such as vomiting, uncontrollable hiccups, weakness, agitation, seizures, and, in severe cases, even death. So, avoid starfruit at all costs. If you have kidney disease, other medications can be harmful. If your kidneys are already damaged, certain medications can worsen them or cause kidney failure. Talk to your doctor before taking medications for cholesterol or diabetes, antacid medications for stomach pain, or antimicrobial medications such as antifungal and antiviral drugs. In some cases, your doctor may recommend a lower dose to minimize the risk to your kidneys. Did you find the video informative? Were you already aware of the medications that can potentially harm the kidneys? Please share your thoughts and comments below. Your feedback is valuable, and sharing this knowledge can help more people. Today, we discussed 8 medications, but there are many more that can have similar effects on the kidneys. If you want to know if the medications you are taking are on this list, you can check the adverse effects section in the medication leaflet. Always follow medical advice, as your doctor likely considers the risks and benefits before prescribing any medication that may affect the kidneys. Your health and well-being are their top priorities. Remember that this video is for educational purposes only. If you have any doubts or concerns, consult a healthcare professional for personalized advice. Thank you for watching. Don't forget to subscribe to Incredibly Healthy for more valuable health and wellness tips. We've selected another video popping up on your screen right now that you might also enjoy. Feel free to check it out. Take care. See you in the next video. Bye.